Hi, I'm Scott Hagus, and I'm the founder and chief strategy officer of Medstatix. We were founded on the premise that the relationship that exists between doctors and patients is the crux of healthcare, in the history of healthcare, and will be in the future of healthcare. We believe that technology as a component to enhance and optimize that is what's going to revolutionize healthcare. There's roughly a $700 billion wasteful spending that exists in the United States annually in healthcare, and we believe that at some level this might just be a customer service problem. Furthermore, the entire industry is recognizing this, and recently, just last month, the HIMSS Leadership Survey announced that 87% of respondents of that survey said that patient satisfaction and patient experience is going to be a top priority of theirs in the course of the next 12 months. And they're doing this because of the confluence of pressures that exist in what's called the triple aim of healthcare: payers, providers, and patients. The payers are administering new reimbursement models. Providers are being mandated to deliver higher quality healthcare at a lower cost. And patients are bearing the brunt of all this cost, and therefore treating healthcare decision making much like they do other consumer channels. Medstatix sits at the crux of this problem by our SaaS cloud-based software system sits right in at the point of the visit, where we connect directly to the EHR, which is the electronic healthcare record. We capture data about that patient, about the visit. We push that to the cloud, where we provide analytics to deliver back to providers areas of which they can improve and provide better communication with their patients, and then tools for doctors and patients to connect when they're outside of the ambulatory setting or a hospital setting. Our analytic platform provides predictive analytics in a number of key areas. I don't know how many of you are in the healthcare world. Revenue cycle management is a key component to success of healthcare businesses. We're able to predict patients who are likely to have their payments go into collections, therefore impacting revenue from a hospital and a practice. We also are able to predict providers who are at the highest risk for litigation, and we then can predict loyalty and retention of patients and provide those solutions in a number of different channels to keep them in touch with their doctors. Our system is quite unique in that we take a very specialty-specific approach. So the line of tools and services that we deliver to a practice in obstetric setting is very different than what we would do in an orthopedic setting, because there are different types of patients and therefore a different type of visit. We're a fully automated reporting dashboard and engine, cloud-based HIPAA-compliant data exchange, and we provide secure web services for fully integrated solutions for our clients. The space itself is quite massive. If you think about traditional enterprise software in general, you can bucket into maybe CRM and ERP, each roughly $20 billion space. And I would conjecture that in healthcare, an EHR is an ERP in healthcare. But the untapped space, really, and nobody's been able to crack this yet, is CRM in healthcare. What is it that can be done? We think that's the type of data that we collect, our experience in patient engagement and customer analytics, we're well positioned to take advantage of that market opportunity. When we started off, we realized that a go-to-market strategy of direct sales, so to hospitals individually or private practice individually, was not sustainable, nor was it cost-effective. So we became the first white-labeled reseller model of a patient engagement platform. And in 9 months since launching our reseller model, we've reached just about 2,000 providers on our system and engaged with 2 million patients. With the current pipeline of sales from some of our resellers, we anticipate being at 10,000 doctors, reaching 10 million patients by the end of the year. We are, however, in late-stage negotiations with 2 of the leading EHR companies right now to fully integrate our platform into their systems, which would exponentially change our numbers. It is a subscription-based model that we provide to our clients. So having the right product in the right space, I think we have the right team in place as well. We have workflow experience, clinical operations and IT management expertise from our CEO. We have scalable software technology development experience from our CTO. My background has been in customer relationship management and data analytics for the last 20 years. And 2 of our advisors and active board members have had very successful exit in the software development space. Navneet Gosal was the founder and CTO of CareFusion, took that public in 2009, and Assam Abdir was the founder of AppMobi, which had a successful exit in Intel. So we truly believe that we're in a position to completely transform the 1 minute news, completely transform the relationship between the doctor and the patient, and look forward to answering any questions later today or tomorrow if you're around. Thank you.